Hello, this is Travis Rogers with SPLG, powered by the Travis Rogers Group, Medical Logistics and Supplies. Today we're going to be talking about the antibody test for the novel coronavirus, also known as COVID-19. This test is going to test specifically the IgM strand as well as the IgG strand. And this is going to help you understand whether or not you have antibodies for the novel coronavirus. So this kit is designed for simple administration from an individual. So a couple of things are going to come in the kit. With the kit, you're going to have one testing kit that actually will hold the vial. It's also going to come with some diluting solution. The two things that you'll need outside of that are going to be antiseptic swabs or alcohol, as well as a finger prick to draw blood. But the way I describe it, if you can take a pregnancy test or you know someone who may have had a pregnancy test, you'll be able to administer this test as well in 3 to 5 really easy steps. Now I'm going to turn it over to Dr. Oleg Turkot to be able to explain the technical pieces to making sure that you know how easy it is to administer this test for you.
So, hi there, my name is Dr. Oleg Turkot. I'm an assistant professor with Johns Hopkins, and let me tell you about the test. It's a capillary blood test, which means all you need is a small prick of your blood. Once you open up the kit, what do we have inside? You have a small cassette with several very important parts. You're going to have a sample of vial, and then additionally you're going to have your testing area. Testing area is going to become very interesting because up top, under the letter C, you're going to get your control strand, and then on the bottom you're going to get the test strand. This helps you make sure that the test is working accurately and that your results are actually something that can be trusted. Overall, antibody tests are really good at diagnosing past coronavirus disease. It doesn't diagnose exposure, but does diagnose if you've ever been sick. When you look at the specificity and sensitivity of these tests, they will vary, but often will be in the 90th percentile. It can be very effective, especially if you want to know if that cold you had a couple weeks ago was actually COVID-19 and you had a very light reaction, versus if you are just sick with something else.
Dr. Turkot actually made a very good point, which is if you believe that you currently have the coronavirus, it's important that you not take this test because it is after you have had the coronavirus, it is past its gestation as well as infection stage before you administer this antibody test. Is that correct?
Yes, it is. Absolutely.
Fantastic. All right, so let's jump in. The first thing we'll need to start with, like I said, which does not come with the kit, you'll need an antibacterial swab.
Correct. So what we're going to do is I will act as a model for how this test works. We're going to clean the area with the alcohol to make sure that everything is sterile. We're going to pierce the skin. Travis, can I ask you to give me a hand with piercing my skin?
Yes. All right. And 3, 2, 1. There we go.
And then as we gently gather a drop of blood, we're going to make sure it drops firmly into the well. A simple 10 microgram drop of blood is absolutely adequate. So that goes right into our well, right in the middle. And then on top of it, we're going to add 2 drops of developer. One and 2. And then we're going to set a timer for 15 minutes. Very rapidly, these tests give us results. And as you see it developing, you're going to see a purple line slowly fill the developing chamber.
And if you can see to the right of the test, you'll see a C and a T. The C is the control and T is the test. So as the chamber fills, you'll see the control line appear within 2 minutes. And then we're going to wait the 15 minutes for the test. Now, Dr. Turkot also made a very interesting point as we discussed this. The tests take 15 minutes, but after 20 minutes, they're no longer valid. So there is a viability window, and it's important that you are checking the timer on this so that you don't miss the viability window.
Absolutely. In addition to that, we want to make sure that we keep the packaging closed, because after an hour of it being open, it may not be as effective. So the manufacturer recommends the test is used within an hour of the opening of the packaging. So if you take a look right at the test, so we see the control line coming in rather clearly as a dark purple line. And now it's only been about a minute. It's going to get darker, and then we'll be able to see if the antibodies come up positive.
So I'd love to use this time to talk a little bit about what the antibodies are, because I believe information is power. So Dr. Turkot, can you talk to us a little bit about what IgM and IgG is? Now, before we begin, just to let you know, this is not something that you have to know to administer the antibody test, but I think it's just good information to know.
So if you have an infection, your body recognizes it with white blood cells. Once the white blood cells come into contact with bacteria or a virus, they mark it. The mark that we'll typically use is called an antibody, and it helps highlight that bacteria or virus as something that's pathogenic, meaning bad for you, and let your immune system fight it. That's what we're looking for today. Now, the IgM is the very first antibody that we often have, and it often will come positive in about 7 days after, for example, a COVID-19 infection. It can be very sensitive and will be made of multiple parts. While IgG tends to be the antibody that lasts for a really long time. This is also the antibody that will be transferred from mother to child, and it also plays a really important role in our bodies.
Thank you for sharing that. So again, just remember, this is not information that you need to know in order to administer the antibody test, but we want you to just have a little base around what is going on, particularly because this is a novel virus, and also there's just not a lot of information about how antibody tests work. So again, our timer is going to tick for 15 minutes, and we'll check back in 15 minutes.